that are responsive, accountable, and last but not the least, cost effective. We want to respond to all your needs, but at the same time, we are accountable for what all services we are providing, and also we want our services to be cost effective. So continuing on this, we are going to present today's webinar, which has been titled as Prescription Practices in CGHS. Now, continuing further, I'll now request my colleague, Dr. Amita Bali, Senior CMO working in the Medical Store Department of CGHS, to share with you some details about the procurement process of the medicines being given to our beneficiaries and also the prescription norms of CGHS. Over to you, Dr. Amita.
Okay. On behalf of the CGHS doctors and staff, I wish all the CGHS beneficiaries a very good afternoon and namaskar. Central Government Health Scheme is perhaps the only health insurance scheme having an open-ended system of procuring the OPD medicines. There are three categories of supply of OPD medicines in the CGHS. First and foremost is the main source. Almost 600 medicines are procured in bulk through the medical store organization, and these are supplied to the wellness centers for ready availability to the beneficiaries. Majority of these are generic medicines in compliance with the government's policy to promote generic medicines. Out of these 600 medicines, majority are present in all wellness centers all the time. And so when the patients who come to us in the wellness centers for majority of the diseases, treatment is started immediately and there is no lag period because these medicines are always present in the wellness centers. Second category are those medicines which are not always available in the wellness center, and these have to be indented through the authorized local chemist against the individual prescriptions. And third category are the life-saving medicines. These are procured through the authorized distributors against the individual prescriptions as per the laid down guidelines. The majority of the medicines are procured for CGHS through the medical store organization, which provides the beneficiaries the medicines through the bulk procurement following an open tender process. The MSO uses its monopsony power to procure medicines in bulk directly from the manufacturers, bypassing the wholesaler as well as the retailers. And hence we have the dual advantage of ready availability of medicines for the beneficiaries as well as savings to the exchequer. Now, we are asked about why there is so much focus on the cost. The CGHS beneficiaries, either being serving government employees or having retired from the government service, do understand that under the ambit of the general financial rules, the prudent utilization of public funds is mandatory for any government entity. And CGHS, also being a government entity, is required to prudently utilize the available funds, including the subscription that we receive from the beneficiaries, so as to provide the maximum health facilities, including the quality medicines to the beneficiaries. Now, when we procure the medicines for CGHS, it is of paramount importance that the quality is ensured. And there are multiple layers of quality audits during the bulk procurement for CGHS. First of all, the manufacturing units are surveyed and only the WHO GMP certified ones are selected. Due diligence during the tender related quality checks, such as the requirement for the GMP compliance, is important. From each batch of medicines which is supplied to our stores, random samples are checked, and these samples are tested in 2 NABL accredited laboratories. Any sample which is of substandard quality is immediately rejected, and the manufacturers are blacklisted. And only those samples which pass our stringent quality tests are supplied to the wellness center for use by the beneficiaries. Another issue that we commonly face are the prescription related issues. The CGHS beneficiaries often are prescribed medicines by the trade name by the specialists of the empaneled hospitals. This is contrary to the government policy to promote generic medicines. So the CGHS beneficiaries, especially the elderly ones, often suffer from multiple ailments and they are required to visit several specialists. And multiple prescriptions, often having the same medicine by different brands, are advised by the specialists. It is very often seen that these specialists of different specialities are prescribing vitamins, painkillers, and sedatives, and the beneficiary, being unaware of the chemical formulation, is unknowingly partaking multiple doses of the same medicine. This results in over medication, which may be detrimental to the health of the beneficiary. So, what is the role of the CGHS doctor? First of all, preventing polypharmacy and over medication. The CGHS medical officer, who is the single point of scrutiny of multiple prescriptions, he uses his knowledge of medicine to screen such multiple dosages of similar formulations, thus preventing the ill effects of over medication in the patients. This medical officer behaves like a family physician, and since he has referred the patient to various specialities, the patient comes back to him with the prescriptions, and it is a duty of the medical officer to see that there is no overlap in the prescriptions. As mentioned earlier, painkillers may be written by many specialists, and if the patient, who is, especially if he is an elderly person, consumes these painkillers, it can be detrimental to health. It may cause kidney damage and other illnesses in the parent. Secondly, it is important to ensure implementation of the government policies and guidelines. A doctor working in the CGHS Wellness Center is governed by the Indian Medical Council regulations, and he is duty bound to follow various government policies, including the promotion of generic medicines. The CGHS doctor thus has a mandate to prescribe the available generic medicines with the same chemical formulation in place of the branded medicine prescribed by the specialists. Sometimes patients have confusion regarding this, regarding whether these generic medicines are of the same value and of the same efficacy as the branded medicines, and this will be discussed by the following speaker.
Thank you very much, Dr. Amita, for a very informative talk, which I'm sure must have. Thank you very much, Dr. Amita, for your very informative talk, which I'm sure must have answered many questions and clarified many doubts in the minds of our beneficiaries. If you noticed, during her talk, Dr. Amita mentioned about the generic medicines. I'm sure many of you must be wondering, what are these generic medicines? Why their use is being talked about? Why there are generic medicines, if any, in my prescription? Should I be concerned using these generic medicines? These are very legitimate questions which need to be answered, and any doubts pertaining to these need to be resolved fully. To answer some of these questions, today we have with us Dr. Preeti Kumar from Public Health Foundation of India, an organization of repute working in the field of public health for decades. Dr. Kumar is a researcher with a long and extensive experience in the field of health. She has also worked on the subject of access to medicines and generic medicines included. Responding to our request, she agreed to share some of her observations, data, and viewpoints with us all, which may help us to get an answer to our queries and build our faith in generic medicines once again. Now I'll request Dr. Preeti Kumar to share her presentation on generic medicines with our listeners. Dr. Preeti, please.
Okay, so apologize for this little transition confusion, but the topic for today is building confidence and trust in generic medicines. So why are medicines important? We all know, we can all really understand that the entire world as a whole is aging. But unfortunately, as one of our achievements is that life expectancy has increased, but that has not really resulted in healthy years of life. And we are all aware that as we are growing older, many of the non communicable diseases, diabetes, hypertension, mental health problems, cancers, there is an increase. And unfortunately, polypharmacy or the need for medicines has become a part of our lives. So, what did the world decide to do in 2015? They signed something which was sort of a moral, sign that we'd made, that agreement that we would work towards good health for everybody, our 8.4 billion population across the globe. And as a part of that health, access to safe, quality, effective, and affordable medicines is a very important part of achieving health. So there was this film. I'll step back from the topic and talk about a film which was released in 2001. Given the link, you might like to watch it. So what happened was HIV epidemic in the 1980s. The world was hit by this epidemic. We have 35, 40 million people across the world, very young people who had HIV. But where the disease was in Asia, in Africa, of course, it was in the developed world also. But because the medicines were in the developed world, while the disease was in the developing world. Yeah. So the problem that arose was that the cost of that medicine was $12,000 for a year's dose. And what did one company, you all are very familiar with that company, Yusuf Hamid he came up with a generic version through of manufacturing the same HIV medicine, and he brought it down to less than $1 a day. So from $12,000, just because of the competition which was introduced, even those medicines fell down to about $5,000, $4,000. Now today every third person across the world is on an India-made drug. And in the field of HIV, 1.5 million, 15 lakh, 15 lakh Indians are on lifelong HIV drugs. And the outcome of that medicine in terms of the HIV suppression and the life expectancy of a person who has AIDS are similar across the world. So what are the financial implications of buying medicines? It has to be, medicines have to be effective, and medicines have to be cost effective. They have to be less costly. So what we realize is when you look at these numbers, and I'll take my cursor here if you can see, as the age goes up, our expenditure on medicines increases. This is for the public sector, what a public per capita expenditure happens, because most of our expenditures are unfortunately out of pocket. Indians pay a large majority of their payments on health, which is private, out of their pockets. While the private, you can see how much it is, fourfold expenditures across all age groups is by the private sector. Now, this is the expenditure which is on medicines. This is the overall expenditure. So, if I am working in the public sector and I have access to medicines in the public sector, my per capita expenditure, what the government will spend on me as a 59-year-old would be on an average 387. But then the government would spend 216 rupees out of that on medicines alone. And that is the reason why we really need to understand the importance of medicines, which we all realize. So, medicines expenditure form about 45 to 60% of the cost of our out-of-pocket expenditure. In the developed world, where the per capita expenditure on health is very, very high, people have a lot of money which is spent on their health in USA, medicines form about 18%. But here, because our per capita is much lesser, the share of medicines tends to be very high. And therefore, many people are not only able to not afford it, they don't access treatment because they cannot afford it. And that is why countries across the world, in developing countries, in USA, in Europe, they are pushing their formularies to adopt generic medicines. And where do these medicines come from? They come from, a large proportion of that comes from India. Yeah. So I'll go through these numbers very quickly. Our industry is huge. It's humongous. 2.89 lakh crore is the worth of a pharmaceutical industry, of which 50% we spread internally and 1.5 lakh crore gets exported. We have about 3,000 companies. They have 10,500 units and they produce 2,500 formulations. But what is very interesting is that though the number of formulations, A, B, C, D, E, number of drugs is 2,500, when they are sold as brands in the market, there are about 50,000 brands. Remember, in many countries in Europe, they would not be selling these brands. It is a very thing which is very unique to the Indian market, and therefore which creates some confusion, which I will go into a little later. So overall, the health expenditure is about 5 lakh crore. 1 lakh crore is spent by the government, 4 lakh crore is spent by our own pocket, out of pocket, and of which 4 lakh crore, 1.5 lakh crore is spent on medicines alone. So understanding generics therefore becomes very, very essential. Why not go for medicines which are equally good and then don't cost as much? So let us have some understanding about generics. We all talk about brands, generics, patents, but we are not really clear what it really means. Many of you might be knowing, but even for us as researchers, it was a very good to go into the pharmaceutical market and to really talk to the companies to understand what these definitions really mean. A generic is the chemical name. It is universal. It is essentially the pharmaceutical ingredient. Patent means somebody spent their own money, some university or a government grant or a company will spend their money to discover a new chemical for which they have been granted a patent, a license, as well as they have been told nobody else can produce this medicine. Now, what is the fact? When we talk about a generic, when you go to the market, please remember there are very few generics available in the Indian market. When you go and buy, and I know everybody knows the drug paracetamol. So when you will go to a retailer, when you will go to a chemist shop, you will not get a paracetamol. You will get one brand or the other, some which you will recognize, some you will not recognize. Generic, the word that you always talk about, is only about 10% of the total market, internal market, which is bought by CGHS, defense, railways, and other state governments. Patent drugs, what you understand by patent drugs, that is only 5% of the Indian market and only 0.65% of the volume, which means they are expensive, right? So 6.65% in volume translates to 5% in terms of money value. So they are high value drugs, very, very limited. Patent medicines are very few. And now, what is this branded generic? Branded generic are non-patent medicines. So they are not patented. Everybody is free to manufacture them, whoever gets the license. But they are sold by the name of a brand. 2,500 generic medicines are being sold in the market as 50,000 brand names. And why are they being done? Because somewhere they have built that they are perceived as quality. So let's talk a little more about generic drugs. All the molecules in the market, save that 5% are generic medicines. Generics are not copies of brand generics. Remember that. That has to be very clear. There is some bit of an unlearning that we need to do. We just need to improve our understanding. Generics are not copies of brand generics. A generic can only be a copy of a patent, not of a branded generic. They are all identical. Generics are chemical names. A generic drug in every way, according to the Drugs and Cosmetics Act, in every way is identical to the branded one medicine that you purchase in the market, in its form, in its safety, in its strength, in every way it is identical. You have only given the name as a brand name. Now, where are the generics manufactured? Exactly in the same facilities and manufacturing units that are approved by the State Drug Controller Regulatory Authority. Every state has a regulatory authority. It's a government state regulation. And many of these are WHO GMP approved. Now, why are generics cheaper? That is where we come to. It's because they are copies of patented drugs. So I will pause here. I will not talk why are generics cheaper or less costly, because we always tend to think cheap may not be of good quality, but that's not accurate. Let's go to the next argument. Why are branded medicines so costly? Instead of answering the question why are generics less costly, the reason is because despite the large number of producers, as I mentioned, we have 3,000 companies which are producing these drugs. Competition is unable to exert a downward pressure. Why does that happen? This is a very unique market. Vertical product differentiation. There is a premium on brands. I told you 2,500 manufacturing medicines which are 50,000 brands in the market. And then there is something which is known as a horizontal differentiation, which is called the fixed dose combination. You are combining a medicine for fever with a medicine for anti-allergy, with a medicine for decongestion of your nose. And you are saying that I'm going to combine these three. And mind you, most of them are not approved. But individually they are approved doses. And so you can circumvent that little flexibility and you have fixed dose combinations. Out of the 50,000 medicines that are in the market, 50% of them are fixed dose combinations. It doesn't happen in any market in the world. And the third reason is prescribers. Remember, when you go to buy, say, a sack of potatoes, right? Aap aloo kharidne gaye. You are the buyer and there are 10 people on their ready in their shops selling potatoes. You can make a decision because you can pick up a potato and you can say that I want a big one or a small one, and therefore the relationship between the buyer and seller is transparent. I have a choice. But in the medicines market, you as a patient don't go to the seller, to the retailer and say, I want to buy this medicine. Apart from a few over-the-counter medicines, there is somebody who is between you influencing your decision. And who is that influencer? It is the doctor. By virtue of his ability, he makes the decision on your behalf. And therefore, that is the reason why in a pharmaceutical market, while you have so many players, the cost of the medicines doesn't come down because the decision is being influenced which medicine to buy, which brand to buy by your prescriber. Now, let's take a few examples. Let us say what happens when we do a market where we are creating brands. What is the role of a brand? It is an economic argument. Let us take one drug, telmisartan. I will not use any company's name, of course. I'm just using the chemical name, which I am authorized to use. It is a 40 milligram tablet. It's an ACE inhibitor. 126 companies are marketing 143 brands. One company, same formulation, identical dose and strength, it is producing by 3 companies. 15 companies are producing 2 brands. Why? Just think about the logic, because when you create so much of, let's say, confusion, so you are compelled to pick up something. The only thing which will distinguish between them will be the price. And so the perception which is raised in your mind is, okay, if these are 2 identical medicines which have identical dose, strength, even the same company, the only thing that distinguishing them is their price, and you will by default pick up the more expensive medicine. And we have another company. So the same company, rupees 7 for a tablet and rupees 6 for a tablet. Across all brands of companies, this difference ranges from 0 to 25%. Let us pick up another one, paracetamol plus tramadol. We all know tramadol is, you cannot really buy it as an over-the-counter medicine. You have a combination. 70 companies are marketing 80 brands. 10 companies produce 2 brands of the same formulation. So you will see when you're looking at these numbers that per tablet, the cost has got humongous difference. Rupees 4 per tablet to rupees 10 per tablet. And I'm giving only very average cost differences. When you see the company that is a market leader, that the per tablet might be rupees 20 and the cheapest medicine might be 2 rupees. So then the difference becomes even much larger. Now, let's talk about fixed dose combination. So I spoke about brand and I said there is a proliferation of brands in the market. The other thing that they are doing is we have fixed dose combinations. The fact is, as already been said by my speaker earlier, it causes confusion because there tends to be a replication of medicines in these FDCs. They account for half of the market. Out of 2,800 formulations in the market, FDCs are almost more than 50%. 3/4 of all vitamins, minerals, nutrients by value are FDCs. We never get vitamin B1 separate or B2 separate. You know, there are always multi-B complex mixed with iron, with calcium, with vitamin C, with a stab of zinc in it. So these are FDCs. And every time you tweak an FDC molecule, you create a new product and you have a new pricing on that product. So these are a very significant reason for the differences in the price of medicines that you see in the market. Now, I want you to pay a little attention to this. Why are best-selling drugs often highly priced? Market leaders in the pharmaceutical sector, that means for every medicine, there are a top few firms and a top few brands, and they continue to charge prices that are relatively higher than the other market participants, especially because we are saying all the medicines are the same. They are all being regulated equally. They are being manufactured actually in different units, brought together, branded, and then sold in the market. Now, this is a little counterintuitive. Why should something which is selling the most be the most expensive? It does not happen in any other market. If you would go to a car market, the brand which is lower cost, all things being equal, your sale of the lower cost of cars or any product would be much higher than the top premium. But it doesn't work in the pharmaceutical market because competition doesn't exist. The ones that are pricing it high, they're making the most noise about it, are also market leaders. So let us give some examples of best-selling drugs that are often highly priced. You know, premix insulin. It might be a laggard, means the lowest cost one would be sold at 15, and I'm talking about branded. And the market leader would have 96 or even higher. Diclofenac sold at rupees 10 and it only costs 83 paisa. And we are not even talking about manufacturing cost. And so the cost difference goes on and on. Now, the third reason is we have brands, we have fixed dose combination, and when you tweak even 1 milligram here or a 2 milligram there, you can change the medicine and sold it as a new product, and then you can price the new product differently. And the third reason is because of the doctor, the prescriber. Now, the pharmaceutical industry is actually one of the largest spenders on promotional expenses. because direct to consumer advertising is not allowed. You cannot sell it like any product that you use in the house. How do you advertise then? You move through the physician. And so the consumers, the companies, they then go and influence the physician. And it is very well known to us that though physicians are highly talented, they are very, very busy people, and they have very big practices, and they are extremely busy with that. So their maximum information that comes to them is through two sources. One is through some of the conferences that they attend, which are again sponsored, and the other one is physicians directly through the medical representatives. Therefore, brand creation, again, I come back to the word brand creation. They are all generic medicines, but they are stamped with a brand, stamped with the name of a company X or a company Y, and that modifies the name of the medicine and sells it. And they therefore become the reason for market concentration. Everybody gravitates towards that name. So medicine X sold by company Y is the most highly priced, and nobody is going to ask how did it reach from the manufacturer to the shop, but the cost then becomes the marker for perceived quality. And therefore, this becomes a huge challenge for us to defeat the high price of medicines. Now, dying to survive. My point here is that there is a recent Chinese film which came out, and it has created a lot of stir, which essentially talks about that China is very contrary, very counterintuitive. They started importing affordable generic medicines from India for leukemia. And the drugs that were sold without a license in China, and they were sold at a fraction of the original price by the hero of the movie. Watch it online. What is my point? My point is that there is a lot of cost which is added. What you see as the last point, what is your maximum retail price? There is a lot of cost in the supply chain that is added, which is borne by the consumer. So you will see that when you move from right to left, the final price is what you see as 100, of which taxes are about 12 to 18%, but on an average, we consider 12% GST on all medicines, except a few. 28% is the retail margin. The wholesale margin is 7%. C&F, your carrying and forwarding agents charge 2%. And what is the residual cost we assume as the producer price? So for a medicine which costs 100 rupees, let us assume 51 rupees is manufacturing and 49 literally goes in bringing it to the shop. So I will now bring it back again to you to explain where the savings are. So we have done some comparison between the RMSC, means the Rajasthan Medical Supply Corporation, and the market price. We will not look at this very busy chart. What I wanted to mention here was we did it across different categories of medicines. We did it across painkillers, anti-diabetics, cardiac medicines, and antibiotics. Everywhere, the price ratio per tablet varied from 2.86 to 11, 5 to 24, 5 to 23 in rupees, 3 rupees to 8 rupees. A huge difference. Why? Why do costs vary so much in the private market that you procure and the government that procures is? Remember, the first thing we need to understand is there are no generics in the market, very, very limited. You might go to a wholesale market and get some generics, but not in a retailer shop. So absence of intermediaries. I mentioned in the last slide, 49% of the drug cost is going directly for your logistics, trailers, retailer, wholesaler, carrying and forwarding agent, it goes there. The second is monopsony power. What does it really mean? A company is so happy to sell it to CGHS or railways or police or the government system because you are assured of a client. If I am assured that 1 million tablets of mine are going to be sold to the government and I'm guaranteed a price for it, I am more than happy to give it at a much more competitive rate. This is known as the monopsony power in procurement, which you are all so well aware of. There is no brand promotion. We mentioned to you that pharmaceutical agencies, probably after the oil companies, have the highest level of brand promotion, and that takes in a lot of money. And lastly, the production cost of most medicines, especially chemical medicines, we are not going into the new biologics, etc. They are expensive, but they're largely patent medicines. The production cost of medicines that have moved out of patent is largely much lower. As a point of view, even the vaccine that has been produced by Pfizer, and I have read it as much as an information on the internet as much as you may have, it costs 22 cents for production. It costs 72 cents for production, costs the UK government 22 pounds per vaccine to be purchased. So we must understand why the costs that are procured in bulk, there is a solid evidence to say that that is why they are less costly. Now, we come to one word. So we've tried to talk about the cost. Let us talk about the quality. That is one thing which is being sold because of a brand. That is why they say, oh, it's a brand, that's why it is of quality. But according to a regulatory authority, there is no way for it to distinguish between a branded medicine or a generic medicine. So the standards for compliance to a generic medicine are identical. A generic medicine will be rejected on exactly the same parameters as a branded medicine. And remember, please come to the last two lines of this slide. In regulated market in the north, where a large share of India's products is exported, they are all generics. So the same medicine which is coming off the procurement unit is a generic. It gets stamped and it goes out as a generic. It gets stamped with a brand. It is sold in our market as a branded generic. That's the difference. Quality. So the CDSCO, that is the national body, it does every month it does some routine inspection of the medicines. What I wanted to say is there are two categories. One is not of standard quality. The other one is spurious. See the last line. Spurious drugs is very insignificant in our market. False, counterfeit medicines. They are not what they're supposed to be. That doesn't exist. What really is different is the not of standard quality. And the point is, NSQs not of standard quality, while it was found that the government procurement had a wider range, 0 to 9%, but it varies from state to state. And the quality of drugs where it is procured centrally in those states, you will see clearly Delhi, West Bengal, Goa, the not of standard quality was only 0 to 2%. And the not of standard qualities which were picked up from samples in the retail market, domestic, MNCs, medium and small industries. I do not have the liberty to mention the companies. NSQs are found across. We should minimize them, but they are not unique to the government system. They are present equally in the private sector. So I have spoken about it, and I will only, what I explained, I'll again say the national survey which was conducted across 50,000 samples which were taken from the retail sector, from the government sector, it did not attest to the predominant view that small scale industries were responsible for producing substandard medicines. They were present equally. They should not be, but they were present both in the private as well as in the public sector. How do you reduce it? Pooled procurement mechanism. Coming back to from where we started, CGHS, where you have centralized mechanisms will always put in layers of control to ensure that only quality medicines are procured. So lastly, let's come to the prescription practices of the practitioner. The fact is, any market which is regulated, where we have so much pride in saying that their medicines are of quality, is because only generic medicines are prescribed. Our prescribers find it very difficult because they, number one, is it's self-regulatory. It is not enforced, and therefore it becomes a challenge to tell private practitioners to prescribe generic medicines. The second reason is that there is a lot of influence of the pharmacy, of the companies on them, that also sort of changes their behavior. Lastly, what is the solution? We can always find gaps. How do we deal with it? One of the ways is that actually enable it through IT solutions. So whenever our beneficiaries come to any CGHS dispensary, there is a drop-down list of medicines. They just have to prescribe it, select it, and it comes out as a prescription. This is precisely what should be pushed even in the private sector, because doctors say, oh, it is very difficult to write a very long chemical name. I want to write 10 medicines. So one way of it is to nudge the doctors to move towards IT solutions. There is another reason why I wanted to say, doctors genuinely do not know the cost of drugs. And therefore, it is very important. How many times we have gone to doctors, they were not aware. They said, oh, if I had known this medicine is so costly, I really would not have prescribed this medicine to my patient. So IT solutions actually allow you to have the name of the drug along with the cost, enabling the doctor to take a more reasonable decision regarding the medicine that he is prescribing to the patient. So in conclusion, I will say, assuring the quality and safety in a scientific manner is the work of regulation. What I wanted to spend my time today was to explain that there are largely no generic medicines present in the market. Everything which is available, the so-called brands, are actually generics. They are only been given a name. We are all women, we have different names, right? The next one is increase our awareness about how the market works. Generics are procured by the government system because they do not write any brand. They are called generic. The same identical medicine is sold in the market. It is called a branded medicine. And through such conversations, such discussions, we can build the consumers' information, educate them, and increase their knowledge about the medicines that they are purchasing in the market, and build their confidence in the medicines that they are taking from the government pharmacies. Take the vaccines. We have all lived through 2 years of the epidemic. It has ticked all the right boxes. The vaccines have been procured, literally, they've been manufactured in either universities, or they have been manufactured with government attention. They are being manufactured and everybody trusts them. So there is very little vaccine hesitancy. So I think the reason is that whenever there is an information gap, that leads to some sense of disbelief. And one of the aims is get educated on generics, understand no generic is sold in the market. Whatever is being sold is branded generic, and it is identical to the generic which is being procured by the government system. So what is the future? Online pharmacies. I mentioned to you, you see the drugs, you see their cost. The regulation tends to be more transparent. You can see what you're buying. You can compare the cost of medicines, and perhaps that is the future forward for ensuring that we buy quality medicines and we buy cost-effective medicines. What is the role of all of us in it together? Let us obtain medicines from known and reliable sources. CGHS said it. We buy it from GMP approved units. There is no bigger stamp than that, than to buy it from a GMP approved unit. Second, engage. Engage through consumer forums, engage through committing to the government. The third is action by the regulatory authorities. Definitely there is need for more investment in regulatory bodies, so that they can actually go to the market and pick up the correct samples and actually do far more investigation and quality testing of the medicines in the market. Then the next one is affordable medicines. That is very important. Our pharmaceutical industry is very, very important to us. There is no doubt about it. It needs to prosper. But making medicines more affordable to our people should also be the goal of the pharmaceutical industry. And lastly, I talked about brands. packaging becomes very important. So barcoding, good packaging will enable the government and the consumer to have more confidence in each other. Thank you so much.
Thank you very much, Dr. Preeti, for such a lucid and interesting presentation, simplifying the most difficult concepts. I'm sure our beneficiaries must have attained a reasonable clarity on what these generic medicines are and dispelled the doubts about their being left efficacious or effective. Why often the medicines in the wellness center prescriptions are generic medicines? Last but not the least, I would like to reassure all the beneficiaries that we at CGHS are at your service to provide you the best possible healthcare services in line with our vision and mission. But at the same time, we will request you to have full faith in us and our services to give us a strength to work with all the commitment and zeal for you and your family's good health. Coming to the chat box where we have received a number of questions and comments. Many of the comments have lauded our efforts, and many of the questions are directly related with today's webinars, while some others are related to other problems these CGHS beneficiaries are facing. Picking up the questions which are related to today's webinar, one of our senior citizens has said that while there has to be a permission every time they have to visit any panel hospital, our dear beneficiaries 75 years of more than 75 years of age, let me tell you that you can visit the panel hospital without taking the permission from the CGHS Wellness Center. That's the provision exists for our beneficiaries more than 75 years of age. Then some more questions about dispensing of the medicines. Before I go to the related questions, there is one question for Dr. Preeti. If generics are identical, then why do doctors prescribe branded only?
That's a good question. I think I did mention it, but perhaps it was not clear. Doctors are not told by law. It is self-regulatory. IMA encourages doctors to prescribe, write generic medicines. There are two issues here. Doctors in the public sector will write a generic medicine because he knows that generic medicine is available in the formulary. So if he writes paracetamol, the patient will go to the formulary to the pharmacist in the government facility and pick up paracetamol. But the problem in the private sector is paracetamol does not exist in your market. So even if the doctor is going to write paracetamol, he will go to the pharmacist who will now then decide for the patient that what to give. And the pharmacist is not allowed to do substitution, which means if the doctor has written, I do not want to take a brand name, if he has taken one brand name, say Calpol, the pharmacist is bound to give him Calpol. The pharmacist cannot give him a substitute for Calpol. So if he writes paracetamol, paracetamol is not available in the retailer shop. The second reason is that the doctors themselves find it very difficult. So they say, oh, we have to write chlorpromazine. It is much more easy to write a 4-letter brand name of the drug. They're busy people. They have 100 patients that they are looking at. It's private practice. They find it very difficult. So there are multiple reasons why doctors don't write generic. Number one, if they write, it will not be available in the market. They know that. The second reason is that they just feel that it is very easy to write a brand name and not the generic name because it takes them more time. That's the reason they give us. So we said, why not have an IT the way CGHS have? You have an entire formulary on your desktop, a software, and you just take the medicine and you can prescribe it.
Thank you very much, Dr. Preeti. I think your explanation settles the questions which the beneficiary has asked. A very valuable suggestion coming from one of the beneficiaries that most of the time the prescription written by the doctors are not easily readable. They are confusing. So the doctor should be writing in capitals. Very well said suggestion. We'll try to pass it on to the doctors, or at least if they are not written, the prescriptions are not written in capital, they should be easily readable. There should not be any confusion what is written. Then we have many more questions regarding the prescribing practices in the CGHS Wellness Center. For Dr. Amita, one of our beneficiaries saying for lifelong diseases like diabetes, thyroid problem, CGHS doctors can repeat the prescription given by the treating specialist. This will reduce the visits to the specialist doctors.
Sir, all our medical officers are highly qualified doctors and they can continue treatment which has been started by any specialist. They can get the patient investigated, they can follow him up, and they can modify the treatment where required. And after a period of 3 to 6 months, you can get a review with your specialist. And there is no rule saying that they cannot prescribe. They are qualified enough and they can treat you very well. Please have confidence in them.
Another beneficiary has said that why or she needs to visit the wellness center every month to get the medicines. Is there any rule, Dr. Amita, that the medicines are will be given only for 1 month?
Sir, as far as the senior citizens are concerned, they can be given medicines for 3 months. And after 3 months, it is important to review them, to examine them. So that is the reason we call them after 3 months. This is for the benefit of the patient.
That means they can take medicines for 3 months in one go.
Yes, they can.
And after that, if they want to have a teleconsultation, I believe the facilities exist for that also.
Yes, they can log on and they can consult their doctor. In some specialities, it is already available. For some, we would like to examine the patient. So it is up to the patient. If they are feeling well and they feel that they can continue with the same medicine, show the reports to the doctor online. So that can be done.
The same beneficiary has asked, can the medicines be given for 1 year?
That will not be proper. That is not ethical. We would like to examine you. We would like to meet you. So once in 3 months, I think is a reasonable time. You can come to the wellness center. And of course, if somebody is going abroad, then we have the provision that we can give you medicines for 6 months.
Yeah, I think in a period of 1 year, any of our senior citizens would like to meet their treating physician, definitely, to get themselves reviewed, to get their blood test done, to get their BP checked, and to see if there is any deterioration or any improvement in the condition, any of the medicines needs to be changed, or any of the dosages need to be changed. So I will just advise the beneficiaries not to go for 1 year medicine altogether, not to ask for 1 year medicine is in their benefit that they must visit the doctor.
Certainly, ma'am. Certainly.
And there are other questions which do not, many queries and questions and suggestions which do not directly pertain to today's webinar. However, we have taken a note of it, like somebody has asked for a webinar on the hearing aids. We'll keep this in mind, and whensoever we have the allocated slot, we'll go for that also. And we would also like to receive many more suggestions from you so that we can make these webinars much more useful for the beneficiaries. So, these are the questions that we have dealt today. If you have any more questions or any feedback, you can write to us. You are all welcome to give your suggestions for further webinars if there are any. And otherwise, we meet every second and fourth Tuesday of the month at 4 p.m. See you next on fourth Tuesday of the month, that is on 28th of December. Wishing you all good health for you and your family, and a very happy new year in advance. Thank you. Take care.